Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to Informed Immunity, the podcast dedicated to bringing you the latest evidence-based information on vaccines, community health, and the fight against infectious diseases. I'm Jara, Director of Patient Education at the Global Healthy Living Foundation, and your guide on this journey to better health. In this audio guide, we'll focus on the challenges of navigating the healthcare system, particularly when it comes to getting recommended vaccines. We'll talk about common barriers to getting vaccination, along with practical solutions to overcome them, so you can best protect yourself and your loved ones. Whether you're trying to navigate the healthcare system, worried about vaccine safety, or just curious about the latest advancements, this podcast is for you. So let's take this journey together and take one step closer to building a healthier future for all. Today, we're joined by Dr. Robert Popovian, Chief Science Policy Officer at the Global Healthy Living Foundation and a leading expert in healthcare policy and biopharmaceuticals. With extensive experience in health economics and policy, Dr. Popovian will help us navigate the complexities of the healthcare system when it comes to vaccination. Welcome, Dr. Popovian.
Thank you for having me.
Could you briefly explain to our listeners the work you've been leading with GHLF in the vaccine space?
GHLF has had a long history of working in vaccine policy and advocacy and education. This is prior to the pandemic, actually. They were very much engaged with adolescent vaccination for meningitis. Obviously, with the pandemic, GHLF took on a larger role in vaccine education and advocacy, and since then, it has followed through and has tried to provide education, research, as well as advocacy in the space to ensure that patients who are vulnerable, especially patients with chronic diseases or autoimmune disorders, have access to vaccines and are educated about the benefits and the risks.
Thank you. I know a lot of the work that we've done has been surrounding common barriers to adult vaccination. Can you please talk about some of those barriers that you've identified in your own research?
Let's start with discussing misinformation. So that's the number one thing. There is a lot of misinformation about vaccines and their safety and efficacy, and GHLF has taken a leading role in trying to educate patients about the benefits of immunization. But there are other barriers. So we've tried to identify, for example, access in low-income communities with regards to a barrier that we've identified. We've did a research on reimbursement and how that reduces access with physicians and pharmacists in immunizing. We've tried to look at how pharmacy benefit management companies have tried to manipulate the market. We've also lauded and supported things like zeroing out-of-pocket costs for vaccination, especially for Medicare Part D patients who are extremely vulnerable since they're seniors. And we've tried our best to also try to identify what are the barriers that patients have through doing survey research that we've published recently.
Thank you. Just going back, could you elaborate a little bit about misinformation? What do you think is the top misinformation that patients have regarding vaccination?
Well, the number one thing is that, unfortunately, during the pandemic, there was a lot of overpromising about what vaccines do. Vaccines, from the minute that they were developed, the intent was to prevent the worst outcome, and in this case is mortality and morbidity. Unfortunately, there was a lot of enthusiasm when the COVID vaccine came out that the vaccines were going to help reduce the spread of COVID infections, and that's not true. Vaccines have always aimed to reduce mortality and morbidity, as I stated, and that's been the biggest barrier in being able to get over the hump with some patients to go back to the basics and explain to them what the value is. So that's the misinformation that was out there about what the intent of immunization is. But also there's been historically misinformation about the safety of the vaccines, which has been refuted over and over again throughout the years. In fact, one of the original publications that sort of raised concerns about vaccination is no longer even available publicly because the journal that published it has withdrawn it, and the individual who published it actually lost their medical license to practice. So again, I think it's twofold. One is the misinformation that is done intentionally or unintentionally with uninformed patients, but also the overpromising that sort of like what vaccines do, which we need to sort of level set with patients, which is they're intended to really prevent the worst outcome.
Great, thank you. You also kind of touched on financial barriers and used the term zeroing out of pocket costs. Could you explain that for maybe one of our listeners who doesn't understand that?
That's an interesting thing. So, through Affordable Care Act, passage of the Affordable Care Act, vaccines have had zero out-of-pocket costs for commercial insurers. Unfortunately, one of the areas that patients still had to pay out-of-pocket costs to acquire the vaccine was among seniors in Medicare Part D vaccines. And fortunately, one of the benefits of the Inflation Reduction Act passage was that they zeroed out of pocket. So now in the United States, unless you're uninsured or you don't have any government insurance like Medicaid or Medicare, there is no out-of-pocket cost for anybody who has some type of an insurance. So as a patient, when you show up at a pharmacy or a physician's office and acquire a vaccine, out-of-pocket costs should not be a barrier that you face as a patient. Now, having said that, Susan, there's a lot of instances that we still see that there has been misinformation or intentionally or unintentionally that patients have showed up to a pharmacist or a physician's office and they were charged an out-of-pocket cost. Partially that has to do with the way the benefit design was placed by either the employer or the insurer that they acquired, where they probably had to pay up front and then get reimbursed. And by the way, that's not the case. The intention of the law is that patients don't pay anything out of pocket when they show up. So there's still some barriers with regards to that, but we are trying to one by one educate the patients to become better consumers and push back when they're asked for any kind of out-of-pocket when they show up at a pharmacy or at a physician's office.
Great. Thank you so much. You had mentioned you can go to your pharmacist, you can go to your provider for vaccinations. Could we talk a little bit about the role of pharmacists in improving vaccination rates?
Yeah, absolutely. And we did a specific study, and I'll mention the study in the context that we're going to be discussing. So pharmacists are one of the most, if not the most accessible healthcare professional in the United States. About 90% of individuals living in the United States live within 5 miles of a pharmacy. And pharmacists have taken the lead pre-COVID, but especially post-COVID with regards to adult immunization. We did a study with IQVIA that demonstrated that about 80% of adult immunization post-COVID is now being administered in a pharmacy by a pharmacist or a pharmacy technician. And that's impressive. Obviously, a lot of it was the COVID vaccine, but since then, the majority of the flu vaccine, majority of the pneumococcal vaccine, and shingles, and now RSV are being administered in the pharmacy in the 80% plus rate. So pharmacists play a huge role in this. And we did a specific study looking at low-income communities. We wanted to see what is the accessibility of low-income communities, by the way, Susan, that are overrepresented by minorities. And what we found is that in low-income communities, there's better access for pharmacies than physician offices who immunize. And why is this important is because one, not only there's physical access, but remember, pharmacies also have longer hours of operation and they are open 7 days a week instead of 5 days usually. So when you add up those things, it becomes not only the physical location, but the hours of operation and everything else makes it even much more accessible. And remember, low-income patients generally are hourly wage earners. So as an hourly wage earner, if you don't show up to work, you don't get paid. So you require access to healthcare professionals who are available after hours of work. And this is why also a pharmacy and a pharmacist plays a larger role in immunization in these type of communities. And as I mentioned in the beginning, these communities are overrepresented by minorities, both racial and ethnic minorities. Therefore, it becomes a DEI issue, frankly, with regards to how we should basically champion and make it easier for patients to acquire their vaccines at pharmacies.
Great, thank you. Can you please discuss the findings from your paper relative to vaccine access and supply, especially for high-risk chronic disease adults?
Yes, so, we did a paper specifically about that. Obviously, these papers are available publicly for anybody can read. We specifically looked at how pharmacies play a large role in administration, like, for example, with the low-income communities, how they're accessible in the physical locations, and how they were doing a significant number of the adult immunizations. But one of the things that we found is that there's an appetite by the pharmacy benefit management companies and insurers to now get involved. Traditionally, vaccines have been an area where PBMs and the insurers have not played a role because there's no out-of-pocket cost. So there's no benefit for the insurer to do anything other than just administer and process the prescription, basically, or process the vaccine payment. But what we've learned is that they are trying to get involved in it, and the reason being for a variety of reasons. Partially has to do because they see it as a profit center that's been untapped. And they're trying to basically manipulate the market to be able to garner more benefits from the pharma companies. And that has disrupted the market, and it's going to disrupt the market, especially for patients with chronic diseases. Because remember, again, going back, Susan, who's going to benefit the most from vaccines? It's elderly, patients with chronic diseases, or patients with autoimmune disorders who their immunity is at risk. So because of those reasons, we need to make sure that PBMs stay out of the vaccine market and that they don't start messing around like they've done with the traditional biopharmaceutical market where the access has been restricted for patients. And because of that, patients suffer.
And so what steps can a patient take to be involved in this greater access and to prohibit PBMs and insurance companies from interfering?
They need to be educated, number one. They need to know what their rights are. They need to know that if they show up to a pharmacy or a physician's office and somebody requires them to pay out of pocket, they need to question that because by law, no one that has any type of government or private insurance should be paying anything out of pocket to acquire that vaccine. So they need to become better advocates, push back if they're asked to do so. And also, one of the things I always talk about is that they need to get educated about what are the requirements for them to acquire this vaccine. So Center for Disease Control provides recommendations about who should acquire certain vaccines. And sometimes those are not in alignment with the Food and Drug Administration label. In fact, they're contradictory at times. And what we need to do is do a better job. And this is where GHLF comes into play, a Global Healthy Living Foundation, and all the patient organizations about educating patients about if CDC is saying this is the recommendation and you show up at a pharmacy and the pharmacist says, or a physician's office and says, you don't really fit the bill with regards to the recommendation, you should be asking why and push back and then try to acquire the vaccine based on your needs and have that discussion with the pharmacists or physicians. Now, fortunately, CDC, they're trying to do much more clear recommendations for these vaccines about the risk of the patients. But unfortunately, this is raising other set of issues that we're now working on because it's making it far more complicated for pharmacists and physicians to identify these risks within their office environments or in their pharmacies.
Great, thank you. That's really important for our patients to advocate for themselves and, as you said, push back and know guidelines and what vaccinations they need and work with their provider to make sure that they're staying on schedule. A lot of education at GHLF is also surrounded about COVID-19, and we had talked about a lot of miscommunication around vaccination due to COVID-19. Can you talk about how the COVID-19 pandemic influenced adult vaccination rates and also public perception of vaccines?
So obviously there was a lot of enthusiasm when the vaccines were being developed. If you recall, Susan, we were all locked up and we were all looking forward to a vaccine that will help us get out and being able to live our lives in a normal way. So the enthusiasm was there. Unfortunately, what happened is that there were some legitimate questions by patients and even healthcare professionals who wanted to know how did we develop a vaccine so quickly and effectively and whether or not the vaccine was safe. Unfortunately, those individuals were sidelined and the questions were not answered. And these were legitimate questions. Even I, as a pharmacist, as a healthcare professional, I wanted to know, how did we get to a point that we were able to develop a vaccine within 6 months when we traditionally develop a pharmaceutical over a 10-year period, right? So there were some legitimate questions that needed to be answered. The other thing, like I touched in the beginning, is the overpromising of the vaccines by certain healthcare officials, both on the federal and the state level. They should have been honest about it. Look, the vaccines, as I said from the beginning, they're intended to prevent the worst outcome, which is mortality and morbidity. They're not there to basically reduce communicable diseases, that we're still going to get COVID, we're still going to get the flu, but when you have the vaccine, it's going to reduce the burden of illness and it's going to reduce the potential morbidity and mortality. So I think that also was a problem that we need to get over. And then frankly, the mandate issue was a problem because it was the first time that people, whether it was employers or government, was mandating people to get the vaccine. And again, instead of having a discussion with patients and answering their questions, they were just telling them, be quiet, you don't know any better, just get the vaccine and everything will be fine. And then when you see these things like in the social media where patients got the COVID vaccine but still got COVID, instead of saying, yes, you got the COVID, but guess what? You're not dead, or you're going to be fine because it's going to be a less severe infection. Or there was a lot of misinformation about natural immunity, right? People were saying, well, I got the COVID infection. Why don't I just get it and develop natural immunity? And then instead of getting the vaccine, well, what officials should have said is that, yes, that is true. You can get the infection and get natural immunity and you don't need the vaccine, but you're also taking a risk of dying if you get the infection versus if you got the vaccine. And even if you got COVID, the burden of illness would have been significantly lower. And that's why I think, Susan, vaccines are the most cost beneficial intervention ever developed by the medical community, by researchers, by biopharmaceutical industry. And what we need to do is to go back to the basics of why they're necessary and who is the vulnerable population that would benefit the most. And it's sad to see now that we're 2-3 years past the height of the pandemic that we have become complacent about vaccination. And in fact, only about 30% of seniors, I think, last year got the new version of the COVID vaccine with the new entity. And this is scary. And we've seen also a drop in other adult immunizations over time and pediatric immunizations. These are scary times. We need to go back to the basics. And what I say to people is that we need to start treating patients as adults and having a conversation with them and not wag our finger and say, you just have to get it and be quiet.
I love that, to start treating patients like adults and make them feel empowered and educated.
Absolutely.
Looking forward, what policy changes or initiatives do you think are necessary to really sustain and improve adult vaccination rates?
Number one, as we started to discuss, we need to ensure that state laws that prohibit pharmacists from immunizing are streamlined and expanded, because pharmacists are the most accessible healthcare professional, as we said before, and especially in the low-income communities. If we want to get low-income patients at better access, we need to have the pharmacists involved. Okay, that's number one thing. So state laws need to be streamlined, expanded. What I say is that pharmacists should have the same authority as a physician in administering the vaccine. Vaccine is not a diagnosis. There's an FDA label, and as healthcare professionals, pharmacists can't follow those directions. So that's the number one thing. Number two thing is that we need to guard against insurers or PBMs trying to manipulate the model for their profitability. Remember, as I mentioned, no one pays out of pocket for anything. So what is the benefit that we're getting here for the PBM involvement? Traditional PBMs and insurers have been involved because there's a benefit to the patient, right? They're going to lower the out-of-pocket costs or cover something. But right now, nobody pays anything out of pocket. So there is no patient benefit for their involvement. So we need to guard against that. Number three, I would say we need to do a better job of educating and advocating for vaccines and need to go back to the basics. As we said, we need to treat patients as adults and encouraging them to get the vaccine, not mandating the vaccines, because that will help. So that will come with ongoing public health type of endeavors that we need to do and reducing the misinformation and everything else. But again, as I said from the beginning, since I've been involved in the healthcare policy space, healthcare in general, I've always said vaccines are the most cost beneficial intervention that has ever been developed in the healthcare system. And we need to become better advocates for these important medicines, because at the end of the day, what we know about vaccines is that they're going to reduce mortality and morbidity. And that's the key.
Thank you so much, Robert, for joining us today and talking about misinformation and vaccine access and really the importance of educating our patient community on vaccination to protect themselves and their loved ones.
I appreciate it. Thank you for having me.
This is Informed Immunity. Thank you for joining us on this audio guide. Remember, the fight against infectious diseases is a community effort, and your participation is crucial. For more reliable information on vaccines and to stay up to date on the latest in public health, visit our website at ghlf.org or check out the Centers for Disease Control and Prevention or World Health Organization website. This podcast was made possible with support from GSK. If you enjoyed this episode, please rate our podcast, write a positive review, and share it with your friends and family. It will help more people like you find us. Until next time, stay informed and stay healthy. Together, we can make a difference.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.